Over 644,955 teenage pregnancies across Uganda during the COVID-19 lockdown, 5 times higher than coronavirus positive cases. About 250 children below 15 years impregnated monthly. The victims and their future, the authorities, partners and other stakeholders, the timely and effective interventions to prevent such threats. In this May and June 2022 in-depth story, does the teenage pregnancy pandemic show the need for sexuality education? I investigated what these victims are going through, what applicable mechanisms can be put to prevent and mitigate the threat, and whether the government, religious leaders, and other stakeholders have picked lessons in regard to the need for sexuality education, focusing on Western Uganda, connecting the dots in other parts of the country. I am Aaron Ayinomugisha, Rise News Uganda, Joint Advocacy for Sexual and Reproductive Health and Rights in Uganda, JAS Program 2022 Media Fellow. Following the spike in teenage pregnancies, especially between March 2022 and July 2021, Sexual and Reproductive Health and Rights (SRHR) organizations, together with other concerned stakeholders, challenged government to swing into action, prompting President Yoweri Kaguta Museveni to rush at them, as some analysts and activists further urged that schools should be reopened.
In 9 months, I have not heard that any child has died from corona. When we are talking about the children who got pregnant there, okay, if they got pregnant, at least they are alive. Don't talk like children, please. Oh, they got pregnancy. What? Fine. Pregnancy doesn't kill, it causes some problems.
In January 2022, schools across Uganda resumed operation, but mixed questions about sexuality education and SRHR still stand, some unanswered. Given the 644,955 teenage pregnancies registered in only 2 years of lockdown, 5 times higher than coronavirus positive cases, according to United Nations Population Fund statistics. During my investigations, I established that in Western Uganda, Kasese district, which was the third in registering high cases of teenage pregnancies nationwide, registered 22,548 cases in 2019, 20, and 2021. The Kasese district health officer, Dr. Yusuf Baseke, says parents, guardians, schools and government and other stakeholders should work jointly to sensitize children to prevent such cases. In Kasese, 22% of the mothers seeking antenatal care are teenagers. On May 19, 2022, a 16-year-old Senior student at Hima Progressive High School gave birth from the bush. Due to fear and lack of proper care, she could hide the baby in the bush and go for classes until locals and authorities realized it. Irini Bira, a nurse at Chinyabwambo Health Center 3, said this teenage mother could breastfeed the baby in the morning, hide in the bush to attend classes, and breastfeed again in the evening. Both the mother and baby are now in good health as police hunts for the perpetrator who impregnated this girl.
And the record was that even the baby, of course, she couldn't raise the baby. I think she had no way of taking the things for using. The baby was that we did the baby birth care, we tied the record.
In other areas, Isinjiro registered 12,409 teenage pregnancy cases in 2019, 20, and 21. Chegerwa registered 12,737 cases, and in Chegerwa, teenage mothers have always decried lack of support after being abandoned by those who impregnated them. A 21-year-old mother of 3 in Buringo village, Kabweza sub-county, Chegerwa district, is one of the many teenage mothers struggling to make ends meet. Even the commodity prices are high. I don't have money to buy soap every day to wash for my children. I don't have money to buy uniform for my children. I'm on my own. Everything I'm on my own. In Kamwenge, 8,328 cases were registered between 2019 and 21. Ntungamo registered 7,694 cases. Mbarara City and District registered 6,489. Ibanda 4,733 cases. Shema 2,583 cases. Wampara registered 1,808 cases. Chiruhura registered 3,525 cases. Kazo 3,535 cases. Among other cases registered in the last 3 years across different districts. In her remarks during Women's Day celebrations at Chamate Ntungamo district on 19th May 2022, the First Lady Minister for Education and Sports, Janet Kataha Museveni, disclosed that the government will soon introduce a policy for teenage pregnancy victims to spend 1 year out of school after giving birth. Minister Janet had earlier expressed worry over negligence among different stakeholders, especially parents and guardians who form the first line of defense.
While I agree that the government has equal stake in all its citizens, parents, or children, or guardians, nonetheless, the family should form the first line of defense and protection for our children, and I hope that we all agree on this one. But it's really disturbing to know that the children are not safe while at home. So what are we supposed to do?
With such a terrifying magnitude, what should be done? I sought opinions from Mrs. Alini Twetedi, the Deputy Head Teacher Kagonji 2 Primary School, Wampara District, and Pastor Labani Kanywa, the Director Global High School Mbarara, who is also the Head of Private Schools Directors, Western Uganda.
When a child gets pregnant at an early stage, it does not teach her or him to get a better future. So when we come across such a behavior, we have guidance and counseling. We have senior man, senior woman who help pupils. So we counsel them, we guide them, we are showing them the loopholes within that. Senior man and senior woman are the ones responsible for the pupils' behavior, which will help them be uplifted morally.
When you look at the statistics of early pregnancies, school-going girls who contracted the pregnancies 2020 and 2021, the number is alarming. That one tells you the importance of schools. When they are in school, at least they are prohibited from unnecessary outings, at least they are guided, at least they are being counseled. We have not been experiencing such pregnancies. But the fact that the runners were at home and roaming in towns and everywhere, that is why you see great number of pregnancies among the school-going girls. The pregnancies have already happened. We cannot retract them. So it is now about how do we handle. Minister of Education came up with a policy that let these girls, at least up to 6 months, let the girl be in school. At least after 6 months of pregnancy, the girl can be sent home to deliver. And then after delivering also 3 months post-delivery, the girl is again brought back to school. Much as maybe that girl may miss out a class or a year, but at least does not miss out education entirely. I am appealing to stakeholders in education. Let us give an opportunity to these girls. Even the community, the parents, give them an opportunity. Some parents are rude. They can decide to just abandon. Somebody who is not educated cannot be helpful even to himself, family, cannot be helpful to his community, cannot be helpful to the nation. Guidance and counseling should be part and parcel, the dynamics of life. 2, as you're saying, sexuality, to know changes that take place. When can a girl get pregnant? To know even the use of a condom. Why not? If you have run out of your senses, you better use a condom. At least we prevent the pregnancies. But more important, even you talked of sexuality, but the spiritual element brought closer to religion and spiritual guidance, empowered them, and even to prevent whatever can ruin their lives.
According to Dafa Esra, a lawyer in the Strategic Litigation Department at the Center for Health, Human Rights and Development, SEHAD, besides other interventions to curb teenage pregnancies, perpetrators should be brought to book and the victims be protected instead of harassment. In some cases, suspects bribe duty bearers, victims left to suffer, perpetrators go unpunished. Esra says sexuality education is everyone's right and victims victims don't deserve stigmatization.
Police, court, and local leaders have tried their best to handle teenage pregnancy-related cases. However, some of them have become so stigmatizing towards the young people who are having teenage pregnancies. This is where you find them being judged by duty bearers who are supposed to protect them, the leaders questioning the young people. What were you thinking? Things like that. I think we should make the environment safe and friendly for them. First, listen to them, understand their story, and do not be judgmental or stigmatize them. What they need is to be supported. I think we need to come up with a multi-stakeholder approach where we fully support and defend the young people, a friendly environment for them to be able to open up to us, share with us their stories, but also for us to guide them and counsel them on how to avoid the pregnancy. We need to do more as a country and give them the best support that we can give them.
It is critical to understand the interrelationship between early childbearing and low education attainment, which negatively impact our communities, especially hindering the national development plans. Being born of a mother or father below the age of 18 increases the risks and negative outcomes like maternal mortality, bad health, domestic violence, and poverty. 1 in 4 girls in Uganda aged 15 to 19, forming 25%, have had a child. 34% of Ugandan girls are married by 18 years, and 28% maternal deaths occur among young girls of 15 to 25. Young people are responsible for the spread of HIV 34% annually. In 2021, about 31,566 teenage girls got pregnant monthly across Uganda, equivalent to 1,052 daily, and about 250 children below 15 years got pregnant monthly. With that picture, it is upon me and you to work jointly, prevent and fight such teenage pregnancies, give a brighter future to those young boys and girls, foster development in our communities. I am Aaron Ainomugisha, Rise News Uganda, Joint Advocacy for Sexual and Reproductive Health and Rights in Uganda, JAS Program 2022 Media Fellow.